I think we should probably start with Dr. Villanti. We have a question from Rafael Meza. What do you think are the policy levers, like products included, enforcement levels, or exclusions, that modelers should consider when assessing the impact of ENDS or cigar, I guess, or even cigarette flavor restrictions? What should we keep in mind when developing these models?
That's a great question. I think enforcement is always a really important piece of these policies, and the extent to which where the enforcement falls. So where does it fall in how engaged is FDA in the enforcement of these policies? I've not seen much in terms of how flavor cigarette ban enforcement has rolled out, or whether that was such a small part of the market that cigarette companies, were okay with dropping those products. But certainly enforcement, we need to think about. And then thinking about, like you're saying, Rafael, I don't have a suggestion of how we deal with these different products, but currently we have different different regulatory paradigms for the different e-cigarette products, right? So we've seen one enforcement action come out against pre-filled cartridges. Well, the products continue to diversify. So making sure that we have some grasp of where we think things are going to be moving with these products, how we think companies are going to subvert potentially enforcement requirements by shifting production or manufacture of specific products. I think there are so many levers that we need to think about. Enforcement is clearly a key aspect, but also, like you're saying, exclusions. How does the market change in response to what's coming? And I think we've seen the way that in a single state, a menthol cigarette ban can produce an entire new class of products that we haven't seen yet.
And maybe this is a good point to just sort of put Rafael into the discussion himself and say, Andrea, or Dr. Villanti, you pointed to and alluded to the development of brand new cigarettes just this year in California, that the California AG has decided to sue British American Tobacco over their sale. Even though they received substantial equivalence designations from the FDA. Are there, this, I guess, is going to Rafael, how would you even start to incorporate a decision like what the FDA has done to, say, grant substantial equivalence and factor that into a menthol ban model? How do you even begin to incorporate these tough but real concerns into projecting outcomes?
And that's a really hard and of course important question. I think part of the challenge, of course, is incorporating that into a model mathematically. Well, you just reduce the effect, right? If you know there's an alternative that will capture some of that use, that's one way. You could get creative and say, okay, well, now these products are going to be a thing and they're relevant enough that you maybe even create a compartment to account for people moving into those. The challenge, as always, is going to be in the data, right? Do we have a sense of how many might actually choose to go into those products? And if so, how? This is one of the areas where certainly the way or the uses of modeling might be different, right? Rather than trying to really project what, or let's say use the model to give your best guess of what might happen, you could use it just to assess what if under different circumstances, right? If there are alternative products that emerge that sort of circumvent the policy, and there is certain level of attraction of users to those, how much could you water it down under certain assumptions? So I mean, certainly in terms of the use of modeling, it brings alternatives that can be considered, and certainly how much you put faith in what the model is projecting, of course, will be based on the type of data that goes into it. But nonetheless, these are questions that FDA and other decision makers need to be considering right now, and so they need to make those decisions before you actually get some of those data. So that's where maybe the what if type of analysis are helpful, at least to help guide some of the considerations.
Can I jump in and just say that the use of modeling here is so important, even if you don't have specific estimates of how much things are going to shift. You can even find like how much subversion of the policy would have to happen before it has no impact on public health. And even that kind of an estimate can give confidence to FDA that, you know, it's unlikely that all of these things would stack up and we would have this much reduction in the policy to reduce the public health effect.
I think that's a really fabulous perspective on it. Let's pivot to Dr. Schneller. We got a question asking, focusing on adults based on your research and that of your Croft colleagues, do you think e-cigarette flavors have a role to play in helping adults to quit smoking?
Well, you're putting me on the spot for like one of the biggest debates in the world here, aren't we? From the data, I'm going to say it does appear that e-cigarettes can definitely help smokers quit. However, that is not to say that they are going to be risk-free in using an ENDS product. Also, you know, the big debate on is less exposure better, or is, you know, are you substituting one drug process with another drug process? Yes, absolutely. We don't want people to be using nicotine at all, but I do feel that it seems that they would have a better chance of using an ENDS product over continuing to smoke cigarettes, and that ENDS could play a role in helping those who smoke quit.
What do you see as the current deficiencies in the studies on that question, and what do you think should be done to improve research going forward in that area?
I mean, I think one of the biggest issues right now is the lack of regulation on the products in general, and that a lot of times we'll get products and they're labeled as, you know, certain nicotine content or whatever, and they are not representing that when we actually quantify the e-liquid, the nicotine in the e-liquid, they're not necessarily showing the same amounts, or even we'll buy multiple products of the same brand, flavor, everything should be the same, but there are differences. So I do think regulation on these products could definitely help. And just moving forward and understanding more of the health effects. And like I said, we've seen data that is showing that e-cigarettes show lower health effects, but they're still relatively new, and continuing to see how health effects differ between the various types of ENDS products.
All right. So we'll go to Dr. Yong. Dr. Yong, how do you see the results of your mechanical Turk studies in comparison to other techniques to examine your questions of interest that incorporate methods like discrete choice experiments or even the experimental tobacco marketplace studies?
Yeah, I agree. Like the DCE probably are more vigorous tools. So our team also used the DCE for several cases. And I'm Turk, of course, many people criticize the quality, which I also totally agree. We can see there are some people just hanging there, always join certain surveys. They make some false statement, they quickly go around. You can take one survey within probably 10 minutes, you can finish within 1 minute. So the quality for Turk is a serious problem. And I think we definitely need more vigorous tools. For my part, our survey, we but at the same time, the MTurk, similar to other ground source tools, can allow you to quickly recruit a large sample. And even there are some rubbish in the data, but I believe overall we can still get some useful and interesting pattern from this data.
All right. Let's ask an interesting one from Patricia Henderson. I'm going to just pose this broadly. I think it might go towards Rafael. Can we account for social constructs such as racism or social inequity in modeling? And if so, how? What sort of data is necessary to get at that?
Yeah, no, this is a very important question, Patricia, and I'm glad you're bringing it up. I will pivot to say that I think within the CISNET consortium that we're also part of, we are right now writing a monograph into how can we bring some of those issues into modeling of public health interventions, and so it's of course a complicated question and requires a very long answer. But in that monograph, there's been sort of careful discussions of where are the places that, of course, things like structural racism, let me focus on that, would affect the health outcomes of an individual, and where do those actually affect the components of different models, right? Or let's say if you have a model of tobacco use, of course, there could be effects of structural racism in terms of the type of exposure that they get into maybe tobacco companies targeting different groups, and for whatever purpose it is, but it translates into a form of structural racism. In terms of, for instance, the effect of interventions and issues with regards to, of course, access, and the fact that some of these issues will play into and go beyond, of course, limiting access and also interactions with the health systems, and that translate into effects on downstream health effects, outcomes, let's say survival curves or high rates of mortality or what have you. And basically, of course, maybe another important one is issues around environmental exposures, that for things like lung cancer is very important, right? That things that you cannot take into account when you're modeling the relationship between smoking and lung cancer risk are maybe differences of environmental exposures due to air pollution and other things that might be the consequences of structural racism. So in that monograph, there's a lot of effort put together on characterizing and mapping those issues to what we can include in models like ours and others, and also sort of a call of where can we get data to inform those issues. Because at the end, just like with the policy effects that we were discussing, it becomes a question of okay, I can maybe find a way to operationally put it in my model, but what are the effects, right? Is it increasing it by 10%, by 50%, what have you? So there's a lot of discussion into how, I guess, the community can help the modelers come up with some data to help us incorporate some of these issues. But certainly very important. And something that, for instance, for the impacts of a menthol cigarettes ban or flavored cigars would be very important to consider. At this point, I guess the models that we have, and I think all the models that I know of, wouldn't necessarily be able to do it. But yeah, it's in the agenda. Let's just leave it at that. Sorry, a long answer, Alex. But
no, that's all right. So I think we have a question that sort of combines yesterday's focus on very low nicotine cigarettes and flavors, and I guess this is going to go a little bit to Andrea, a little bit to Rafael, but this comes from Robert Torch. Would exempting VLN menthols, and I think this is referring to the one that 22nd Century submitted, and I guess we could probably expand this to like anything with an MRTP, We're exempting those products from anticipated proposed rules be a reasonable compromise and help head off the strongest argument against the outright ban that will be used in litigation by big tobacco by allowing the menthol combustible market to continue. However, removing the primary element of addiction, nicotine. Is it a reasonable compromise to let products like that continue?
Yeah, I think there are a few pathways that we can try to keep flavored products on the market in a way that would be aligned with public health. One of them is to go through like a medicinal route through CAsToR at FDA and become truly cessation products. But we haven't seen any e-cigarette products go through that pathway at this point. And so the MRTP pathway is potentially another place where these products could come through and remain on the market with that authorization. But it's unknown at this point how the menthol cigarette ban will impact the current cigarette products on the market, the VLN King.
And I would say that, of course, these are maybe questions, of course, for FDA and in terms of their comprehensive plan. And certainly, I think in some iterations, we've seen more of a strategy, right? Where maybe many flavors from all combustible products are removed. Some flavors in e-cigarettes would potentially remain, or the opposite, non-menthol flavors maybe, or non-menthol mint flavors would be removed, and then of course that then opens to other products, right? Like certainly one that wasn't mentioned, there's IQOS approved with menthol flavor, right? So certainly, as we try to think about modeling the alternatives, certainly the availability of some of those products will affect potentially where current menthol smokers might go if menthol cigarettes are banned. The interplay between, of course, the two policies, right, very low nicotine and the menthol cigarette ban, of course, is very interesting, and I think that's a very a good point. I think the way that I've seen, at least from my experience, is that really in the end, the FDA is moving like one product at a time, one policy at a time, and not sort of making them together. I think that's yesterday's talk of the New Zealand end game strategy is really interesting because they're thinking about a package of policies and they're looking at that together. That again brings the question of that we asked about, so how do you combine the effects? And I think that was very interesting how they're doing it. And so that brings other challenges. But yeah, in the end, is in a way, we have to model what we're seeing. And I think Dr. King responded to that. Yes, see what we're putting out there, see what are the things that we're highlighting, that would sort of highlight what are the things that maybe the model should focus on, but that doesn't mean we cannot look at other type of potential combinations. And I think this is a very interesting one. I don't think that it's in the cards right now. So
yeah. I've got a question, sort of policy detailish, and I think Andrea sort of alluded to it a little bit, which was first, the comprehensiveness of FDA's proposed rule. Is the proposed menthol ban going to, as it was written back in May 2022, would it have covered mentholated roll your own tobacco or pipe tobacco? And what was its position on flavoring accessories, being filters, papers, capsules, cigar, flavoring cards, just to let the folks know?
Yes. So my understanding is that roll your own has come under the umbrella, but what we know happened at the 2009 tax increase on cigarettes, roll your own cigarette tobacco became roll your own pipe tobacco. So at this point, I don't believe that roll your own pipe tobacco would be covered under the menthol cigarette ban. And we have provided data and submitted comments to FDA on that after the proposed rule came out to hopefully cover that. So I don't know what will come out in the final rule, but we can keep our fingers crossed on that aspect. In terms of the flavor cards, I don't know that there's anything written in, but FDA does have authority over these tobacco product accessories. So this is another place where FDA could act to reduce the sale of these sort of workarounds, flavor cards and other things.
All right. This is sort of a zooming out question, and we heard it yesterday, but I think it always bears in mind to hear as many people's perspective on this as possible. But we've identified competing public health interests between never smokers, normally youth, and smokers who are currently using, when we consider restricting ENDS flavors. How does modeling the public health impact of ENDS flavor restrictions reconcile this competing interest? How does the data that you've collected and analyzed here try to reconcile these competing interests? And I'll go to Dr. Schneller first, and then maybe Dr. Yong before continuing around.
Sure. Just gathering thoughts. I don't know per se exactly how I would go about this, but let me try. Okay. So I think it's best to understand the exact effects of having flavors in these products, like the health effects of these products. Flavors have been shown. I know our lab product core for Croft has looked at, I believe it was cherry flavor, and cherry flavor did show that there was toxicity associated with this flavor. So I think part of it is we need to understand those flavor aspects and how it is affecting the consumers, because they're being inhaled and they're not being orally eaten or whatever as they are used for normally. So with that said, flavors are definitely a big part of youth starting, and understanding these, I think, is going to further push for them to be removed off the market. And unfortunately, I do think flavors play a role in adult cessation, but I think that youth prevention would definitely be the priority in the ruling of those products. Did I hit everything?
I think that was a good try at it, and
Thank you.
a good one. What do you think, Dr. Yong?
I totally agree. Like my study, our study focus on current user, focus on current smoker. Of course, for current smoker, we probably should thinking about the alternative which help them at least to switch to some other product less harmful than cigarette and cigar. But for youth and younger adults, we have no, we haven't used any tobacco product. Probably the flavored e-cigarette can be attractive to bringing them begin to join tobacco use. Then eventually they may actually develop to use the cigarette and the cigar. So there's another story for the youth and young adult, totally different. So I totally agree. Like probably for younger adults and youth, we should thinking ban the flavor among all the tobacco product.
That's the one way to go about it. I haven't heard anyone say the word discount yet or anything like that. But are there formal ways to incorporate this balancing into models, or is it purely something that we have to get through more of an ethical lens or even a political lens?
I think. Yeah, no, I think I guess as a modeler, of course I'm biased, but I would think this is where modeling excels, and this is where modeling has a value of really integrating, of course, both perspectives into a model of the U.S. population, where you're both incorporating the potential effects of physics on leading never would-be users of both. Let's focus on cigarettes and e-cigarettes into e-cig users, but then also potentially on the other side also serving as a substitute, and some would-be smokers actually end up would-be e-cig users, and of course also the potential of e-cig users switching to cigarette smoking. So all that can be there, as well as the potential effect of e-cigs in cessation, and then use the models to project what are the short and long-term impacts. Because I think when we're talking about this question, we're talking about short-term effects and long-term effects. Short-term effects because current smokers are the ones who are going to benefit, and current smokers who could benefit from e-cig use are the ones who are at high risk of chronic diseases. They're at the older ages. They're the ones who potentially you could help now. Of course, there is nobody wants to harm any kid, and the potential downsides of e-cig use, of course, would be the long-term use of e-cigs, which certainly will have some health effects. They're not completely harmless, and of course, the potential of if evidence suggests that that's the case of pushing some young people into smoking. Although the data with this fast decreasing turns among youth for smoking doesn't suggest that, but the model will allow you to put everything there and then look at what are the facts. It's a question, like you say, in terms of what are the metrics, right? Is it lives prevent or premature deaths prevented, life years gained, quality of life, or you could look at other issues like that will allow for consideration of equity issues, right? When we talk about smokers, right now we're talking about people with low income, low education, and many other vulnerable populations. And when we're talking about youth e-cig use, it's not the case. So if you would bring an equity lens to this, probably also your answer would be different. But that's what modeling is for, and in a way, it's a little bit as a modeler frustrated to see that a decision has been sort of implicitly or explicitly made without sort of putting all the ingredients together and really looking at the full term impacts, right? I mean, but of course we still trying, right? And but we need help, and so everyone here and everyone who's producing data that can help us do better models and projections certainly will play a key role in helping us answer or contribute to answering that question, that very hard question. You're muted, Alex.
I think we have time for one last question, and I'm just going to make this up. I want to say, if I'm going to put you all in the shoes of making one big ask from the U.S. federal government for data to help your modeling or research needs, what is the one big change you would ask for in improving the data environment to help you do your work better? I'll let anyone answer if each of you have your one big ask.
I have one big ask. Of course, I realize it's not realistic, but we need more timely data. Like with PAD, we're working with pre-COVID or just about mid of COVID data, and that's pretty inadequate, right, for answering the questions that we want today. So I think more speed in getting the national surveys out. I realize this is maybe not feasible for other considerations, and of course we care about data quality, but also investment in rapid response data sources, right, as they might be doing with a new surveillance center. But I would say that, yeah, that's my big ask to everyone.
My ask would be greater flexibility in the instruments. What we know happens now is that a product comes on the market and it takes 2 years to show up in a national survey. And so that's that we're not able to catch things as they're coming up. So the ability to add items or products into surveys more quickly.
That's a good one. Dr. Schneller, Dr. Yong.
Yeah, I would definitely agree with both sides. Also, the ability to have access to, more programs or programmers to monitor like social media, Reddit, Twitter, those types of things to see how, behaviors and products might be changing would be useful as well.
Yeah, I agree on all the concerns. One of my concerns is kind of say, for example, if I would like to check one data, I have to go to the website and read all the document. It can take some time for people without any previous experience. I hope if there are some documents, say, lay out the several major data and make some comparison, and so there are some of them already be there, but if there are more comprehensive list, say, compare the major data source there, may be easier for people to begin their study.
I think those are all really great suggestions. So with that, we've reached the top of the hour. I want to thank everyone for their wonderful presentations. We will be taking a break for 15 minutes. So go get your coffee, and we'll be back with session 4, modeling the impact of regulations restricting flavors in cigarettes and cigars.